The one that impressed me the most was when the therapies work synergistically, when they work together, there is a tremendous outcome that none of the individual therapies could have provided. So in a way, less energy, greater result. So I think very efficient. And from that point, I had my proof, if you like, that I was going to use this. And so I integrated it in my practice, and I've used it for the last 5 years without skipping a beat. My name is Lola, and I live in Western Canada. I am still practicing physical therapist, acupuncturist, and craniosacral therapist. And I've used coMra in my practice and personally for a number of years now, about 5 years. I've been a physical therapist for close to 45 years and an acupuncturist for about 30, and a craniosacral therapist for about the same time. So I've we'll say moved toward the complementary or alternative medicines about 30 years ago. And over the years I became really, I'll say, in love with the holistic approach to life, because it resonated very strongly with how I saw life. I was introduced to coMra through good friends who I trusted, and that was a large reason for me to give it a try. I required surgery for a thumb tendon, and I treated my thumb with a delta, and I noticed the pain was considerably less and the swelling had gone down. So I knew there was something to it. So I had the surgery, but I treated it after the surgery, and I took the bandage off every day, and I treated with coMra, and it healed remarkably quickly. And from that point, I had my proof, if you like, that I was going to use this. And so I integrated it in my practice, and I've used it for the last 5 years without skipping a beat, because it is integrated remarkably well with everything else that I've done in the holistic realm. So it was like one extra hand. I'd worked for previous years with a laser technology, and I found that very useful, and I was happy to use that. But that the coMra with the 4 radiances and the synergistic working of those radiances really took it to a whole other, because we've worked in physical therapy with ultrasound, with laser, with different modalities, but when it was all in one device, that really got my interest. And what I noticed when I started to apply it was that the treatments I was doing, the acupuncture or the craniosacral, would be enhanced. So it would take maybe less time to get the same results. Or I would simply use it in conjunction so that there wasn't an either or. It was always an integrative, and the results seemed to come quicker and more lasting. And then I started to notice something interesting, and that other problems that were associated seemed to resolve without attention. For instance, I would be treating someone's lower back pain, and of course their pain would be better, but they'd also say something like, I'm sleeping better, or I noticed I haven't had a headache since I've been treating my lumbar. And these sorts of coincidences at the time were curious to me. And so I started to really want to know more. And then paralleling my professional practice, of course, I was using it personally and with my family. So I started to notice within myself that when I used coMra, I would feel something in the way of good feeling. But the one that impressed me the most was when the therapies worked synergistically, when they work together, there is a tremendous outcome that none of the individual therapies could have provided. So in a way, less energy, greater result. So I think very efficient. So and also as a therapist, sometimes when I just didn't feel like I had enough time in one session I could use the coMra literally like an extra therapist to work away. And from that, I started to really encourage the people who were interested to get their own, start using it at home. And I served as their guide, and I reassured them that they would be helped along the way. They wouldn't have to figure it all out. And a lot of my clients just embraced that idea. They were ready and they wanted to treat themselves and take back that power that they had. And with embracing that concept, just simply, I can do this for myself. I've got the strength. I've got the power within. I can heal myself, was really the fuel that ignited my passion for coMra and to encourage other people to consider it. Well, I started with usually as a modality that I would use, and then just simply including them in. So can you hold it, for instance, if we were treating the blood, could you hold it up here while I get these, this acupuncture or this exercise or something started down here? And so they would participate. And then when they were comfortable with that, oftentimes I'd use it as a time saver if I was running a little behind. I'd say to them, you're comfortable in the waiting room, just doing your blood before we get started, or offering it as an extension of their treatment. Come a bit early and you can get all this done before we even start. That would be a great bonus. So, and then it was so easy, for the most part, and most people were happy to. They felt quite empowered, actually, doing that. And then from there, some people thought, yeah, I could do this myself. So it helped to have that experience, but also just the participation and the interesting piece, perhaps, that also went along, it was helping me help them. Right, so it kind of came back around the full circle of being part of their treatment, and not just receiving, but also doing. Yeah, so it was a nice and natural step next to get their own. I've always thought that it's a great step forward when we can take responsibility for ourselves and become more of who we are. And as I watched that happen with people realizing that they could become their own therapist, if you like, I moved more into a role, I would say, of guide and less therapist, less doing and more just helping people, reassure them, support them. That felt really like the next step for me as a therapist. So that was an important piece in my own evolution as a therapist, and I recognize that. I jokingly have said that my goal is to have by the time I retire, finally, like this is it, okay, I will have no patients. So that I will have patients, but no clients. And that for me is actually a true life goal. It's insidious at the beginning, but as it builds momentum, it becomes such a strong, powerful force, not just in our own individuality, but in the world. And that just fires me to keep moving and to keep going. And I managed to tear the ACL, the anterior cruciate ligament in my right knee. And that's a fairly significant injury in terms of knee stability. I immediately knew that if I just treated my knee, that would be good. But I also needed to treat the rest of me, so my adrenals, because of the shock of the injury, my brain because I was anxious, and I am now 5 weeks post-injury, and actually I was dancing yesterday without any pain or hesitation. So for me as a physical therapist, like that's remarkable, but as a human being, I'm ever so reminded of our power to heal ourselves, no matter what age, with time, perseverance, and the right support. So to me, that's what coMra represents. It's all of those things. Really, words are difficult to find how appreciative I am of the support and the care, and I would say compassionate care that I've received from pretty well anybody connected with, but in particular Garrett. I've spent many phone calls asking him and receiving his experience and knowledge. And when I meet another human being who is that passionate and that embracing of something, and it has proven only in my experience good results, positive results, healing and healthy results, I'm going to support that with all my heart, and I have done that. But I would say that Garrett from Radiant Life was really the anchor, the anchor for me. So I really want to have that acknowledged, and also that's a rarity in business these days. How can we help individuals, therapists, home users come to understand the benefit that this product can provide in their life? And that's very fresh, refreshing, and very encouraging at this time in our world. Again, it's just gratitude for the whole Radiant Life community, because I think the coMra community, the online groups, everyone that's working in this is supporting each other. And I love that. I just love working in communion and community. That really, really inspires me to keep healthy, keep going, keep strong. And the support is there. And one thing I've learned in life, seriously, I could distill this down to one thing. We can do just about anything if we have the right support at the right time. Well, we're talking about health, so it's the intention to be as healthy, and healthy is a big subject, and it's a lot of, but for me, the intention is, it's very easily distilled down to love and be loved. That's it. I think for me, I'll say joyful exploration of life, and also to inspire others to take a look is really my purpose.